Cool. So you've now registered, you've got your timetable. I was about to say you've collected your textbooks. There's no collecting textbooks. You got to buy them, and they're really, really, really expensive. Ah, Lord, I do remember my first year. That was not really, really nice. So this is a follow-up from our last video on how to navigate dental school. So last time we spoke about how you get in, and now we'll talk about how you can make it out. My name is Craig,
My name is Surprise.
and let's try to talk to you first years, or second, third, fourth, or final years, and hopefully something helps. I don't think this will help final years at all. You already have your thing, but maybe we'll give a tip as well for surviving the dental clinic.
Can you shut up?
So yeah, first year is pretty straightforward. Um, it's just gonna be a lot of science, you know. Um, this is the caveat is this is in South Africa, that's the caveat. But I think I've watched a video similar to this. Um, in America, you have to do a basic degree or something like that. So your first degree is similar to first year. And then first year is where you learn microbiology, biology.
Radiology,
Uh,
chemistry, physics, the basic sciences just to help you build up.
yeah, it's like some repetition for matric. Obviously, there's a bit of some new concepts
A
in
whole
there.
lot.
Yes, yeah, yes.
Unless if we had a different curriculum in like metric, but
Uh,
that felt shallow
uh,
by the end.
yeah, so yeah, but it's not like hardcore physics, but it's physics and it's chemistry. And then you'll start to learn about microbiology. What? Yeah, like bacteria and all types of things like spirochetes and look at that. Look at that. What's this thing? Staphylococcus and streptococcus and all types of coccus you can find out there.
It will mostly all feel like a Harry Potter spell. You might not even remember those by the time you're practicing dentistry, and chances are you don't have to if you're not working in the lab or in oral medicine or specialized, but you will have to learn that to make it to the next level.
Hmm.
Mm.
So I think that wraps up first year. First year is basic science. Basic science. That's first year.
How to survive it? Don't do it alone.
Yeah.
Okay. So if you got in there with like a whole like 7 distinctions, it's very similar to high school, sure, but it's also very, very different. How they ask the questions, the depth they want you to understand, the chemistry in, the physics and all of that. Uh, so working with other students is actually really good. I would suggest even having like two, like not two groups, like two people that you work with, or you could be a group of three, but don't be an island. That transition is not easy. It's if you try and do it alone and you think, easy, you will get 28% on a subject that you thought you're really good at. So
Indeed.
don't be an island. Ask for help. There are tutors, maximize those. Do not be shy. You can be shy, but ask still.
Yeah.
Participate.
Ask questions because remember, it's you who's studying. I'm done. I've got a degree. So you have to ask the questions. Ask the questions. It's for your betterment. And do not be afraid to socialize. Don't be like me, keep into yourself, lone wolf. Don't do that, like try to be integrate as much as possible,
Mm.
and I'm only realizing this right now as an adult. It's good to integrate into society, like do integrate, get a boyfriend or girlfriend or
In first year. I mean, it's
not in first, yeah, but like,
no, you can in first year,
yeah,
but
but
it's not part of the how to get out of
yeah, but
dental school.
be human. That's what I'm trying to say, right? And I know it
Mm.
sounds crazy, but like, you leave school and you have denied yourself human experiences,
Mm.
and then you get into the working world and you deny yourself human experience. Like, just have human experiences. You don't have to do everything. You can say, look, I'll go to one party a year. That's fine, but don't be weird. don't be weird. It's not,
Mm.
it's not cute. It's not cute. Yeah.
I'd say per semester or per quarter. Once per year?
I went to one batch per year.
Mm.
Yeah. So second year,
Second year, and I know they're all different, like vets and what's the one in the Western Cape?
UWC.
Yeah. And UP all have like different, like slight variations in like how they introduce like subjects, like anatomy. I think there's one where they start in first year.
Indeed.
Yeah. But then you'll take it a step further, learning about the human anatomy, human physiology, and then they'll start introducing more specialized material like pathology, disease, essentially.
Mm.
And if you're doing dentistry, introduction to oral disease and all that fun stuff. Also, like introduction to restorations. So you'll be in the lab, in the phantom lab, you have those phantom heads where you'll be practicing how to do a normal filling on like +1, +2, +3, +4. Like you don't, these classes mean nothing to you right now, but they will offer you pamphlets where you will know exactly how to classify each and every cavity. Yeah.
And again, like the DDS, the American version, and ours comes similar, like from second year to fifth year. Like if you're from a different country, I think from here onwards, we're kind of all similar. So the second year is kind of similar. The year where you start doing anatomy, that's kind of similar, right? So you start doing anatomy. Anatomy is where you do see real human bodies. I know, right? Like you see that human body there, that
Fascinating.
cassava,
Mm.
and then you have to like, cut. Scary. The first time you do it, you're like, that's a human being. Yeah. So, but it's fun because it actually shows you like what normal anatomy looks like so that you can find abnormal anatomy. And the cool part about second year is you're going to start working on your hands. So you start working on some models, you start making dentures,
Mm.
bite blocks, special trays. Um, Again, you don't do this outside of like school. I've never like made a denture, but you use some of those principles that you're going to learn so you can actually see if your prosthetic is abnormal, how to adjust your prosthesis, or how to adjust your special tray, or how to adjust your bite block. Or if the lab gives you a crappy one, you can like, okay, how do I find which one is crappy and how do I fix a crappy situation? So it doesn't seem like it then, but that's what it's preparing you for.
Mm.
Because ain't no way I'm gonna make a denture. I'm too rich for that.
Right. Right.
I'm sorry, I'm rich. I like to say I'm rich, but I'm not. But like,
Take it into existence.
yeah, but like, yeah. So that's where you're going to learn, like you said, training your hands. Before you start working on people, you're going to work on phantom heads. So a phantom head looks like a patient, and you're going to start learning this position of working upside down because that is a dexterity thing. Like you have to learn. Like if you wondered, how do dentists work on a tooth that's up here using a mirror? That's what you learn in school. So you train your hands, you train your you get that spatial relation, and you get a class grasp of how everything works in second year. Mm,
Essentially.
yeah.
Uh, Also, I would advocate for food. Don't forget food, snacks, have breakfast or some kind of lunch because those days can drag.
Yes, yes.
Drag.
Yeah.
Like from 2 o'clock until like 5 o'clock, you'll be sitting in the lab looking at a tooth
Yeah.
with just like a lecturer walking around. Master Masondo, that is not right. Like it's a lot. It's and the great kids, like the gifted kids, like they already have good hand coordination. In an hour, they'll be done. You probably suck because you didn't like play with like those wired cars. I never bent anything. I wasn't really playful with my hands. So I did take a bit long and I'm gonna admit it. Around 4 o'clock, I would give up and run away, and I should not have done that. And it was usually because I'm hungry. So make sure you are always fed, like you always have food. Don't starve too much, okay? Because there's just not enough time, and you might skip lunch because a test or what's this? Like a practical went too long, or just the lines were too long at the cafeteria.
Mm.
But you want to make sure that you always have some form of sustenance to help you through those long, long days.
Yeah.
Yeah.
Because you are in the lab basically the whole day.
Mm.
Uh, and again, the key thing about dental school, right? If you really, really want to be a dentist, really like that's what you want to do in your heart of hearts, you have to be willing to take anything that comes your way. So if you're not good with your hands, don't beat yourself up and say, I'm a loser. Oh my gosh. Like, trust me, like anything else in life, handwork is something you can improve on and you get better with that, because I'm going to say it openly in front of the camera. My hands suck generally. Like, I don't have good hands, or like, I can't even paint or draw. That's why I do music, because my brother used to draw and he used to be better than me. I was like, damn. So, music, you don't need hands. You just need, like, you know, muscle memory, I guess. So my hands are not that good, but now today I think my hands are okay. Like, I do good work, but it's practice, and the more you practice, even in varsity, it might be hard to grasp the dexterity, but do not be hard on yourself, because guess what? I was like number last. Ah, but the work doesn't show that now because you practice. And even when you leave private practice, when you leave dental school, you can still practice. Practice, I mean, I still practice till today because, practice makes almost perfect, I guess. Yeah.
Mhm. All right.
Third year.
And by some miracle, you made it to the third year.
Oh,
And this is where you start seeing patients. You start doing extractions, you start doing fillings, not yet at root canals. You're doing root canals in the lab again with just like a tooth. But for the most part, you're doing a lot of dental work already. Uh, the most important thing, again, showing up for clinics, whether you have a patient, you don't have a patient, your face being there, you being there does teach you to show up, because it's quite easy to bunk sessions. It's quite easy to cancel. But then you always feel it around August when
quota.
you've got to reach a certain quota. So you must have done at least 20 silver fillings. Those you see those old silver fillings. We might not do them anymore, but they're still done in school, or you have to do a certain number of classes of fillings. There's no point in me teaching you the classes now, but you have to do those, or a certain number of extractions, or having showed up a certain number of times in the surgery, in the clinic. Or what else do you do there? Oh, radiographs as well. It's like super easy. It's not really hard to go take like panoramic x-rays, but you can only pass by showing up. I think for third year, fourth year, fifth year, you are guaranteed at least 40% by showing up. Because yeah.
And 40% is all you need to qualify for the exam.
Yeah. So
You need 50 to pass, but 40 to just get in.
yeah. And so basically showing up every day guarantees you that you are gonna pass,
Indeed.
or you have a higher chance of passing, unless if you like really mess up on your academic side. But otherwise, showing up is very, very important, and it's the easiest to ignore. And because it's hard, the supervisors are mean sometimes, or your patients are tricky, and you haven't really mastered your dexterity and everything. So it's really, really tense. And they check everything. Like, is your chair clean? Is your counter clean? Oh Lord, I'm revisiting all of this. I'm thinking about trauma of like
all of it. It's so like everything is checked. Like, if you come today and you do a filling, it's like, we'll probably do like yesterday we did like 3 fillings in like 30 minutes. And it's just like G, and you're like, oh wow. But in dental school, they check every step. So first, they'll check, has you opened the tooth? Oh, that's good. And then they'll check, oh, you placed a liner. Good. Oh, you placed bonding agent. Good. So like, you take how long to do a filling? Probably like 2 hours to do one filling. 2 hours. Contrast that with 10 minutes and 2 hours. But you're still new. So you don't need to be rushing. You're still new. And besides the clinical load, it's the theory load. So now you're going to start doing like real like medical modules like pharmacology, anatomical pathology, um, either that general surgery, anesthesiology, you know,
Introduction to
yeah,
orthodontics.
it's like
Mm.
it starts becoming like really like you start to see the picture now. Now, all that stuff you're doing before, the physiology, the anatomy, the science, starts to become very narrowed and focused
Take
in,
shape, focus on dentistry and just
you know,
the greater sciences.
and as you focused on the human body. And this focus on the human body is like, why do this? It's like, everything's kind of linked. And when you do something like oral medicine, you start to see like, oh, I learned that in pathology. Oh, I learned this there.
Physiology.
And this is
Yeah.
where it all comes together. So you can start to see that picture coming together. But it is tough. That is one of the toughest years. We lose a lot of soldiers.
We lose a lot of
A
souls.
lot of men don't make
I almost like didn't make it through there. I dropped out in my third year.
Yeah,
Yeah.
it's very stressful. And will you get slightly stressed? Maybe.
No, definitely.
But again, do you want this? Do you want to be a dentist? Do you want to be a dentist? Then you have to go through it.
You gotta play that 300 music, Tom. During
Do you want to be a dentist? Do you want to be a dentist? You have to go.
yeah, but like the drama of like,
Do you?
how bad do you want this?
Yeah.
Because good Lord, you will question
Yes.
yourself a lot.
You will question yourself a lot. Like you will. Yeah, there's some people who cruise through it and don't like, feel it. But you will feel some type of pressure.
Wait, do you know anybody like that?
I don't know. There's a freak out there,
Maybe there's a freak out there.
there's a
But
freak.
everybody I know from dental school suffered,
Yeah, well,
without exception.
Yeah.
Even the number one student.
yeah,
Mm.
you will feel it. It's quite demanding. But just rest assured, I'm not a smart guy. Craig is a smart guy. I'm just average. Like, look at me today, sitting in front of a camera. They call me doctor. You know that. Can you believe that?
Right.
Yeah. So like, just know that if you can see a guy like me, bald head, yeah, you can do it. You can do it. You can do it. Everybody gets a dental degree.
Mhm.
That was supposed to be motivation.
Yeah, of course. I feel inspired.
Thank you.
Feel inspired.
Yeah. So
You gotta stay off the snow. Well, and if you survive third year, honestly, failing fourth year and fifth year will be just an option.
I
'Cause
mean, it happens. It happens.
it does happen, but it's an option.
I mean, it based on the university, the lecturer, the HOD. You know, you know, like some schools. I've heard some people failing fourth year in some schools.
I was thinking about the clinical part. Oh, no, academia is still something you have that you still have to study the theory, but I was mostly thinking about the clinical side.
Yes.
If you pass third year, you should pass the clinical aspect of fourth
Yeah,
year
def.
and fifth year. Fourth year will still be challenging in theory, but nah, I have no tips for you. They just study hard.
Okay.
But
I'm saying procedure wise. So
Mhm.
with third year, you're getting introduction into procedures, right?
Mhm.
Fourth year, you're building on that. So fourth year, you start doing your root canals. Fourth year, you start doing different types of prosthesis. In your first year, you're doing like full fold. So full fold is a full denture. So like,
Hmm.
you're making it yourself, everything start to finish.
Mm.
Fourth year, you start doing chrome, right? Although in the outside world, chrome is not as popular as it used to be, but like it's still something you just have to learn. So you learn the principles of denture design. You start doing, what else do you start doing? Orthodontics. You start doing like
Just examination still.
surgical extractions. So you start building on that knowledge that you were building on before. So yeah, you add to it.
Yeah.
Uh,
So yeah, but don't sleep on the theory because, like as you said, fourth year can still dribble you.
mm.
But yeah, again, third year showing up, fourth year you will manage, and final year is in Medusa. There's no SMU, Sifako Mahato. There's no theory in final year. It's just practicals and some assignments here and there, but not really much spending hours and hours and hours and crossing over studying. It's mostly you integrating everything you've learned from first year up to fourth year and treating a patient holistically. So they'll give you a patient with a lot of problems in oral medicine, in operative dentistry, in prosthodontics, sometimes orthodontics, and you must just treat the patient from beginning until the very end. That's usually how it goes. And when I said it's like an option, whether you can pass final year or fourth year, it's usually like things from first year, second year, third year, following up. Like if you were used to missing some sessions or dodging some things in those years, it usually would catch up to you around those parts, slowing you down compared to like the rest of the group. But yeah, you can still definitely catch up.
Yeah, and final year is basically all out clinical. Like
Mm.
that's when you are basically a mini dentist. Like you're doing every single procedure, not every single procedure you're gonna do out there, but I'd say 80% of what you're gonna do out there, you're doing in final year. Uh, Again, some of the procedures you're not going to do in school, like aligners, implants, but this is stuff
Braces.
braces, what else? Yeah, that kind of stuff. But that's stuff that you will actually pick up with the competencies. Remember, it's about the competencies, about the hands and the diagnosis. So if you have that, you open up like doors to more procedures. So if you're in final year and you're thinking, I've never done an implant, don't stress. Like you have opportunities to do that as long as you understand how to use your hands, you'll be pretty good. So again, throughout these years, there is quota. You have to finish X amount of cases. So that's the stress, but it's doable. It's doable because we've done it. So I think that's a run of dental school. That was
Mm.
fun.
Yeah. So best of luck with the journey. If you've already signed the contract, you've gotten in, it's too late to think about it. You should have listened to our first video when we said do something else, but you chose to do this. So welcome to the club. Hope you survive it. And yeah, some of you can reach out if you have any questions and we'll be glad to help.
Yeah, reach out.
Peace out.